Greetings. I'm Christine Alpe from Oregon Health and Science University, presenting an update on our research on interlibrary loan and document delivery in North American health sciences libraries during the COVID-19 pandemic. My co-authors are Priscilla Stevenson, Jenny Pierce, and Margaret Hoogland. We spoke about this project last year at Northwest ILL, and our 12-member research group has updates for you from each of our teams: the survey team, the secondary data team, and the primary data team. Each team's work is complementary, but on a different timeline so we can inform each other's work. We're bringing together perspectives from library staff gathered by the survey team about what happened in ILL from March to August 2020, with the secondary team's analysis of aggregated request data from that period, as well as the prior year. We're also looking at online availability of requested and unfilled items, and we'll use that same approach to our primary data analysis of local data from all systems and content types requested. The primary data team will also study document delivery. Here's the timeline for our research with the completed boxes in teal and those in progress in gray. We published the project plan as a report from the field in the Journal of Interlibrary Loan, Document Delivery, and Electronic Reserve cited here. It has taken us longer than expected to get to this stage, but the survey team is ready to publish, and the primary data team is ready to define their study plan, as you'll see in the team updates. We deeply appreciate the ILL community's participation in responding to our 26 questions to help us understand practices, policy decisions, and staff perceptions. The online survey was distributed in January to February of 2021 to primarily health sciences library email lists. Our analysis includes descriptive data from the multiple choice questions and subgroup analysis by type of libraries, as well as thematic analysis of the open-ended questions. Our final question about what else we should have asked raised a lot of additional questions that we passed on to other teams or would be good for future research. We're almost ready to submit an open access manuscript, and we'll announce it broadly to the ILL community when the results are available. Our 431 participants represented many types of libraries, with the majority working in hospitals. Across all types of libraries, 69% reported ILL services continuing via telework. We will be looking at those operations by type of library in the article. 45% ceased ILL from print, whereas 77% still use their physical collection for document delivery to their own user groups. To the question of unfilled ILLs, 58% agreed that more requests likely to be filled from print were returned unfilled. We got a lot of feedback about our survey design and the challenges of addressing multiple types and sizes of libraries with varied collections. What was similar across the respondents' comments was the struggle but perseverance of library staff through challenging circumstances. And we were surprised by how emotional it was to read the stories disclosed by respondents and to decide what to include and share as part of our research. Moving on to the secondary data team, whose goal was the aggregated DocLine data comparison of fill rates and the type of materials requested during the pandemic to the prior year to see if there were differences. This is to address the reporting in the survey and also comments on discussion lists about difficulty filling requests. We're also planning to use the requested journal titles and years to examine digital availability and inform collection development. While this aggregated secondary data was convenient to use and analyze, it represents only 15 libraries borrowing and lending through DocLine, and we will be using digital availability data gathered this year in 2021, rather than being able to see what access might have been during the pandemic, if access has changed for better or for worse. Our preliminary result is that for our 15 libraries, the odds of having an unfilled request in 2020 during the pandemic was almost 3 times as high as that of having an unfilled borrowing request in 2019. We have more analysis to do on the digital access to unfilled or highly requested materials, as well as a journal level subject analysis of request. The methods developed for this analysis will be used also by the primary data team. We knew there were questions that we couldn't answer with the survey or with secondary data from ILL systems. The primary data group will request data from individual libraries to study document delivery and ILL from systems in addition to DocLine. One of the surprises of our survey was the number of additional questions people thought we should ask. This kind of participation is one of the reasons we chose to stagger our research so that it could be community informed. Here are some examples of the questions requiring primary data. How did the ILL and document delivery volume of requests, turnaround time, or fill rate change compared to the prior year? Did it vary for different types of content, especially for loaning books? And did experiences vary by types of library, size of staff, or when staff were able to return on site? We want to end this with how you can use our research. First, we hope that anyone who's interested in doing research on resource sharing might be interested in our methods or our survey questions. Our findings also suggested questions or approaches that we're not able to pursue, but that might interest future researchers. One example is analyzing email discussion list archives to see what happened with requests posted there during the pandemic. Locally, the findings may be useful for emergency preparedness planning, budgeting, evidence-based collection development, or digitization prioritization, as well as policy, service, or workflow changes at institutions or within ILL systems. We want the findings to positively impact our profession, so we plan to focus on sharing the gaps in digital availability of journals with those who own or steward that content, so they could consider putting it online. So that's our update with where we are on this project. We welcome your questions or comments, and we thank you very much for your interest. Again, we want to acknowledge our 8 collaborators who are not co-authors of this presentation, and deeply thank all of the library staff who participated in the survey. Thank you.